for your kind introduction, and thanks for SINOVAC for the invitation. So I'll share my screen here. All right, so can you see the screen?
You can proceed, yeah.
Okay, great. So good evening, everyone. It's very honored to share our research about safety and immunogenicity of CoronaVac inactivated vaccine in people with 6 different types of chronic diseases at this meeting. So my name is Zijie from State Key Laboratory of Conservation and the Utilization of Bioresource at Yunnan University. So currently, massive application of COVID-19 vaccines is a major approach to reduce SARS-CoV-2 transmission and COVID-19 symptoms worldwide, and thereby recover socioeconomic activities. An inactivated virus vaccine is one of the most widely administered vaccine type in China and in many countries, with over 2 billion doses vaccinated. However, many gaps of knowledge about application of the inactivated vaccine remains to be studied. For example, the application of inactivated vaccine in people with chronic diseases still lacks data support. Many studies have reported that COVID-19 patients with chronic diseases are more likely to develop severe symptoms and death risks. Immune protection against SARS-CoV-2 established by vaccine are particularly important for such special population with increased vulnerability. There has been several studies about people with underlying medical conditions on various types of vaccines. For CoronaVac inactivated vaccine, immunogenicity and safety in patients with autoimmune rheumatic diseases has been reported. In this study, we focus on immunogenicity and safety of CoronaVac in patients with 6 types of very common chronic diseases, including coronary artery diseases, chronic respiratory diseases, diabetes, obesity, cancer, and hypertension. Given that senior population are more susceptible to severe symptoms when infected and chronic diseases are more common in senior people, our study mainly focused on people above 40 years old. So for 6 groups of patients and health controls, we aimed to evaluate the neutralizing antibody seroconversion rate 2 weeks after the 2nd dose of vaccination. We also collect and evaluate the adverse drug reactions occurred within 2 weeks after each dose. Additionally, we will compare geometric mean titer of neutralizing antibody across groups 2 weeks after the 2nd immunization, as well as 3 and 6 months post-immunization. So this is an ongoing study, and tonight I'm going to share you the data of the first endpoint after the 2 weeks post-vaccination. We are currently still collecting the data for the 3 months and 6 months post-vaccination. And on the left figure shows the distribution of collected samples in 6 groups of diseases. Hypertension and diabetes patients were relatively abundant, while other 4 types of diseases were relatively fewer. Indeed, we are still actively recruiting additional participants to expand the sample size in these 4 groups. While these numbers are, well, currently this figure shows the number I were discussing today. So the age of our participants ranges from 40 to 91 years old. We divide them into a mid-age group from 40 to 59 years old and a senior group older than 60 years old. The distribution of age are quite close between diseases group and for both mid-age and senior participants. Another important variable that could significantly influence antibody response are interval between 2 doses. This variable is distributed in a tight range among mid-age and senior age groups. So to qualitatively analyze humoral immune response after the completion of 2-dose immunization protocol, we use neutralizing level of 8 as a cutoff and computed seropositive rate of health controls to be 88%. And combining all diseases group, 86 people exhibiting seropositive neutralizing antibody levels. And performing chi-square test on seroconversion rate between health controls and each chronic diseases groups revealed no statistically significant differences. So this indicates, in terms of seroconversion, diseases people and health controls are equally effective. And next, we use neutralizing antibody titers measured using live virus test for quantitative analysis. So the geometrical mean titer of health controls are 30.4, and the geometrical mean of coronary artery diseases, chronic respiratory diseases, and diabetes are a little bit lower, but not statistically different. And other diseases are very close to health group. And we know that for diabetes, there are type 1 and type 2 diabetes, but they both are equally similar to the health control groups. And studies have shown age-related heterogeneity in immune response to COVID-19 vaccine. So we wonder if chronic disease could affect immune response to CoronaVac differently in mid-age and in senior participants. Indeed, we observe that in mid-age group, cancer and hypertension patients show statistically significant elevated antibody response. And in contrast, chronic respiratory disease and diabetes show significant lower antibody response in senior group older than 60 years old. This result suggests that chronic diseases could influence immune response in an age-dependent manner. However, we also note that antibody level differences observed in each age group are in relatively small magnitude and may not really contribute much to the clinical outcome. So next, we will switch gears from immunogenicity to safety evaluation concerning adverse drug reaction. So adverse reaction data were collected by survey filled 2 weeks after the second dose of vaccination at local clinics where serum samples were collected. So we surveyed occurrence and severity of 17 types of adverse reaction after each dose of vaccination. Local adverse reactions include pain, scleroma, swelling, flush, and rash, and itching. And systematic adverse reactions include acute allergy, skin and mucus abnormality, diarrhea, anorexia, vomit, nausea, muscle pain, headache, cough, fatigue, and fever. In our study, no severe adverse reaction has been reported. Most reported adverse reactions were level 1, and 6 of them were level 2 adverse reaction. So this figure shows the total count of adverse reaction in two separated doses. Injection site pain and fatigue are 2 most common adverse reactions, with more injection site pain after the second dose, as you can see here, and more fatigues are more common after the first dose. And in this figure, we further stratified adverse reaction events count by age and we further stratified adverse reaction event counts by age interval. So the trend that first dose caused more fatigue and the second dose led to more injection site pain are consistent across age intervals. So this is consistent across mid-age and senior group. For both vaccination doses, mid-age group reported more adverse reactions than senior groups. And looking at diseases group separately, we still find mid-aged people exhibiting more adverse reaction than senior people. And thus, CoronaVac is safe for senior people with or without studied 6 types of chronic diseases. Bad thing is that adverse reaction events are sparse in each disease's cohort and are not statistically powerful to compare across different diseases. But the good thing is that this suggests the vaccine is safe in general. So this figure shows the percent of participants in each group who have reported adverse reactions. The number of people reporting adverse reactions are also shown. And because total number of participants in each group are not equal, so the percentage is more comparable across groups. We can see in this data that percent of people reporting adverse reactions are quite close, ranging from 14.6% to 18.8%. And it's basically very similar across different groups. We then use Chisquare Tests to evaluate the differences between each diseases and health controls. So for combined chronic diseases patient and health controls, as you can see here, the chi-square are quite small and with a large p-value. So stratifying diseases type leads to similar result, as you can see here for six types of chronic diseases. So thus we conclude that adverse reactions to CoronaVac in patients with studied chronic diseases are not statistically different from that in health controls. We then stratified participants by age interval. So the bar plot shows that in mid-age group, larger fraction of people with chronic diseases reported adverse reactions compared to healthy controls. But none of those differences from control are statistically different. In senior people, disease groups and health controls have similar percentage of people reporting adverse reactions. And chi-square tests, of course, indicate none of diseases are statistically different from health controls. Thus, our safety data indicate that for senior group older than 60 years old, CoronaVac in people with studied chronic diseases are as safe as in health population. So that's all the data I'm going to share today. Let me summarize our result here. First, after two doses of immunization, seroconversion rate in people with 6 studied chronic diseases are not statistically different from healthy controls. Neutralizing antibody of diseases people are also comparable quantitatively to health controls. And thus, CoronaVac is as effective in people with chronic diseases as in healthy individuals. Overall, adverse reaction occurred in 14.6% to 18.8% of vaccinated people. Most adverse reactions are level 1, while a few level 2 occurred. Severe reactions were not observed in our study. So adverse reaction rate in people with chronic diseases are not statistically different from healthy people. Thus, inactivated SARS-CoV-2 vaccine, the CoronaVac vaccine in people with 6 types of chronic diseases are as safe as in healthy individuals. So with that, I'd like to thank SINOVAC Biotech and Yunnan Professional Science and Technology Department for the support, and also our collaborator in Hainan CDC, as well as people in affiliate hospital of Yunnan University and my team. And I'd also like to thank all the volunteers participated in this study. Without their support, we'll not be able to collect all those data and do the study. With that, I'd like to thank you all for your attention. Thanks.